Thanks, Jessica. Good morning, everybody. I wish so badly we were doing this in person, but hopefully in just a few months we can do that. In the meantime, we'll just stare at Michelle's beautiful background and wish we were all at an island somewhere with the waving palm trees behind us. So anyway, I just want to take a moment to introduce our wonderful speaker, Michelle, who we've had the privilege of working with for many, many years. So Michelle's currently the Infectious Disease Section Director for Georgia Department of Public Health after working for years in the STD section at Fulton Board of Health. She most recently served on the board of directors for the National Coalition of STD Directors, which is a wonderful organization that's helped us out tremendously in our STD Epi program. And also she sat on the advisory board for the STD HIV Prevention Training Center at the wonderful Johns Hopkins University, which everybody in COVID world knows has done some amazing COVID training for all of our new CIs and CTs. Through that university. And then finally, I want to let you guys know, because we are doing GPHA and we have a brand new Epi Award Winners this year. Michelle was the winner of the 2014 Janet Stancliffe Epi Award at GPHA. And she was also the first recipient of the Brenda Fitzgerald Leadership Award, who was our wonderful DPH commissioner years ago. She was the first recipient of that award from DPH. So with that, I want to turn it over to Michelle and go ahead and take it away.
Good morning and thank you. I am bringing greetings from the cyber sandy beaches of 2 Peachtree, but determined not to be judged by my messy office, I thought I would adopt a background that would bring you all joy. So I'm a bit of a novice at sharing screens and all of that. So I want to make sure I get it right. Bear with me and wish me well. Okay, can you all see my screen?
Yes.
Well, see, that's what prayer gets you. All right, let me get it to presentation mode. Okay, now are we all set? Okay, wonderful, wonderful. So the first thing that I would like to do is just acknowledge this time and season that we are in. I don't know anybody who has not been affected by this pandemic. So whether it was your personal battle, the loss of a friend or a loved one, I want you to know at this particular time, standing also on behalf of my family, who has had the unfortunate experience of laying several to rest, not only during this season, but specifically from COVID. My heartfelt thoughts and prayers go out to you as I acknowledge the season that we're in while we're doing this work. So thank you. All right, y'all. So I am coming today to endorse teamwork and working together. We accomplish more when we all work together. So specifically, we have entitled this presentation, There Is No Me Without You, Cross-Cutting Strategies to Enhance Service Delivery. I am a firm believer in the continuum of care and also applying lessons learned from other areas. So y'all ready for this journey? I figure out how to advance my slides. It won't move. Hold on, y'all. There we go. All right. Start where you are, use what you have, and do what you can. Very, very powerful statement from Arthur Ashe. And for many of us, when we think about Arthur Ashe, we think about him as a tennis great. Although for those of us in public health, we do remember when he was diagnosed with HIV. And something that happened to him is that he publicly shared because people were threatened to out him. And he thought about the impact of his family. So I don't think it's just powerful to think about this statement from somebody who was a great athlete, but think about somebody who had a tremendous journey during some time when something was very, very stigmatized. So if you think about public health, we often talk about our lack of resources, both human and financial. But I want you to think about what we have and effectively using what we have. Human resources are a commodity that we cannot duplicate. We have subject matter experts. We have people who have given many, many years of selfless dedication. And I'm telling you, we need to learn how to use those tools. All right, so let's talk a little bit about the great state of Georgia. When you come to Georgia, people assume that if you're working here, you're from here, you understand our layout. And I don't want to make that assumption. We have quite a few people who are registered for this section, but you also may be outside of public health. So the first thing I want to tell you is that there are about 10 million people here. If you live in Metro Atlanta, you know we all go to work and come home at the same time because traffic is something that you have to learn how to deal with if you live in Metro. A 25-minute commute will take you an hour and a half. If you don't believe me, please come visit us at 5 o'clock. The 5 o'clock traffic jam starts every day at 2:30. 159 counties. So for a state our size, that's a lot of counties. What makes it confusing for those of you who think about demographics and data, some of our counties have the same names as cities that they are nowhere near. So I want you to know that Decatur, Georgia and Decatur County are nowhere near each other. And these are things that you need to think about as you are sharing information around data, that you are not only capturing the right area, but don't get so excited when you find the right name, right? And I'm sure Decatur County would appreciate that if morbidity numbers in Decatur, Georgia, and the city of Decatur were kept separate, right? All right, we have 18 health districts. And you say, well, Michelle, that's not a big deal. Everybody knows that. If you are like me and you're a little bit old school, you remember when we had 19 health districts. And so, yes, we had Savannah and Brunswick combined to become a coastal empire instead of separate districts. And when people refer to Metro Atlanta, they're talking about 20 counties. So Metro Atlanta has grown. If my accent and my Southern hospitality has not given me up, I am a Georgia girl, so it brings me great pleasure to not only serve in a place that means a lot to me, but specifically serve in my hometown. Literally, I was born at Grady Hospital, which is about 3 blocks away from the Georgia Department of Public Health. Okay, I'm gonna see if I can get this to play right. I want you to tell me what you see, if I can get it to play.
This is an awareness test. How many passes does the team in white make?
Uh-oh.
The answer is 13.
If you got it right, put it in the chat.
Did you see the moonwalking bear?
So I want to pick up with that theme. It is easy to miss something you're not looking for. That was specifically saying pay attention to the road because we share the road. I want you to know if you're not looking for an opportunity to collaborate, it's easy to miss it. The first time I saw that video, I was very focused on counting the passes because that's the question we're being asked. I did not see the moonwalking bear. But once you know to look for it, the second time you see the video, you always see the moonwalking bear. So I would like to suggest to you, not only are there opportunities for us to collaborate, but that you will see them when you actually look for them, okay? So that was just a little bit of fun. So now I want us to talk about some objectives. The similarities between superheroes and the public health workforce. In the chat, I want you to put the superhero that you have the most in common with. We're going to define program collaboration and service integration. You know, in public health, we have to speak our own language, so we cannot just say PCSI, we have to say PIXI. We want to think about opportunities for collaboration. And also I want to talk about how crucial conversations impact our work. So do we have any answers in the chat about the superheroes? I know we have superheroes out there. And I see that some people did get the number of passes, and also got a Grady Baby shout out, so thank you. All right, Super Mario, Spider-Man. All right, Wonder Woman, yes, I love it. All right, so you can be thinking about if you want to guess what superhero I feel like I have the most in common with. Yes, the reveal, I am Wonder Woman. I think I have a lot in common with her. One, she is passionate about helping. She doesn't mind showing up. She keeps her demeanor fresh, so we don't know how old she is. She's actually very old. For those of you who worked with me a while, you know I changed my hair color just to keep it fresh and keep y'all guessing. So that is the superhero I feel like I have the most in common with. Working on getting that invisible plane though for travel. All right. Not all heroes wear capes. You hear people say that all the time. But as you think about this work and your commitment to this work, I want you to understand you can't do this work and not be a public servant and not be a hero. So I want to take the opportunity to acknowledge while we were in this space, we got a lot of media attention, and most of us have talked more about public health in this season with friends and family outside of public health than we ever have in our lives. One thing that we need to recognize is the selfless dedication of those in the private medical field were known, but not already in public health. So with this slide, I'm going to take the time to shout out some things that I know about. I know that we have had IT staff work every single weekend. I know that people respond to contact tracers well into the night, as late as 11:30 and midnight. I know that we have had some of our nurses literally move their residents and stay on COVID testing sites just because they were concerned about the livelihood of their friends and family. There has been a lot of sacrifice. I wanted you to know and to take this time, you cannot live and work like that without being a hero. So when we think about our military, we often say, thank you for your service. I think this is a good time to say to you all, not only does public health connect us all, but thank you for your service and dedication. So let's look at this first slide. One thing that you want to think about is promoting healthy lifestyles, researching disease, injury prevention. That's what we all would be doing anyway. The difficult thing about the populations that we serve, when we use words like marginalized and vulnerable, we need to understand that's not just what we call them, that they're that way for many different reasons. So it would be a missed opportunity for a client who had hypertension not to be told how that may impact other diagnoses that they have, other comorbidities. Public health professionals, us, we try our best to prevent problems, but when the opportunity to prevent is not there, what is our next charge? Intervention. That is our next charge. I am in an interesting season where after many years in public health, I decided to go back to school. So in this season of working, I'm also a student. Some of you can verify because you get emails from me at weird times. And then I also saw that I had 2 professors who are a part of this conference. So I would be remiss if I didn't take the opportunity not only to shout out all MPH students, but specifically those of us who are at Emory matriculating through the Rollins School of Public Health. So yes, I accept your thoughts and prayers, and I would like to share that I made it out of biostatistics. Hallelujah. All right. What is program collaboration and service integration? It's a fancy acronym for saying we need to work together. So I want to use Walmart as an example. If you go to Walmart because you need a loaf of bread, when you come out, you will have a water hose, a tire, oil for your car, and any type of item for your home, whether it is a pillow or a blanket. That is the Walmart way. If you have ever been in Walmart and went in for one item and came out with one item, I would like to say to you, you are an outlier. The rest of us, when we go to Walmart, this is what happens. Can you imagine if our service delivery was branded with a continuum of care and services for everything a person needed when they walked in the door? If a person coming to get their birth certificate needed to be signed up for WIC, if a person coming to WIC needed their immunization records, if a person who had COVID also understood that they may have been susceptible and experiences other diseases at the same time, imagine what we could do. Ties that bind. So from my introduction, you know that I am specifically coming to you with an STD lens. At one point in my career, I was known exclusively as Syphilis Girl. Please believe it is a term of endearment. An intern told me a couple of years ago, Miss Michelle, do you know if you Google yourself and put in syphilis, all this stuff comes up? I was so impressed. I am so excited. And when I retired when I left Fulton County as a disease investigator, they put Syphilis Girl on a jersey and retired my worker number. So trust, that was a great honor. So I want you to just think about something for this example as we think about ties that bind. STDs increase your risk for HIV. Sometimes by virtue of funding, sometimes by virtue of departments, we silo ourselves off and we don't realize that that is a missed opportunity for integration and more comprehensive services, right? So specifically, I like to tell people, HIV is an STD. And if you think about it that way, you won't miss the opportunity to, one, talk about things that relate to sexual health, but you also won't miss the opportunity to talk about biomedical interventions, for one, like PrEP, pre-exposure prophylaxis, that has the opportunity to only be heard by one audience. A person in a Ryan White clinic that may have a negative partner should hear about PrEP. A person in an STD clinic that tests negative for sexually transmitted infections should hear about PrEP. A person in a TB clinic should have a clear definition that there is an association between HIV and the progression of TB disease. These are things that we can easily do. And these are things that will not only enhance our services, but also it will be very beneficial to the health education of the clients we serve. What about COVID-19? Great question, and thank you for asking. All right, I'm going to talk about the framework of public health essential functions and then go back and talk about COVID-19. So something you need to know, this framework was established in 1994. But when we get hit with epidemics, and now we're dealing with an unprecedented pandemic, for those of us who've been in the field for a while, we've read about the Spanish flu and we thought about what it was like for people to endure certain things. And certainly we've been in a place that none of us could have seen. I specifically told people we are navigating through uncharted waters. But imagine if the formulas that we set out, we adhere to. I want to point out number 3 for you. Inform, educate, and empower people about their health issues. That is something that you will always have to do. In public health, we say prevent, promote, protect. At DPH, we actually replaced promote with inform. Look at number 3, inform, educate, and empower. Many of us have heard people say knowledge is power. We've talked about the difference between looking at health disparities and how they overlay with the health education and sometimes the education of the clients we serve. We definitely want to make sure that people know what's going on. I want to also shout out the health districts that have taken the opportunity to combine their COVID-19 services and outreaches with other things that are going on. Specifically for National HIV Testing Day, one of our metro districts said we would like to have an HIV testing day that includes offering the COVID-19 vaccine. So DeKalb County had every program from Babies Can't Wait to injury prevention to HIV for National HIV Testing Day. That's a good opportunity to make sure that you inform, educate, and empower. Because of this season, people would have easily come over to just see what's going on with the mobile unit that's giving away COVID-19 vaccinations, but we didn't miss the opportunity. All right, why should we work together? One, it actually minimizes the duplication of services. Please put in the chat if you've ever had a client who was working with more than one person in your health district and you didn't know just because the programs were separate. In many districts, if a person had hepatitis, TB, and syphilis, that would be 3 different disease investigators or disease intervention specialists, or some people refer to it as communicable disease specialists. Now, if we add COVID-19 to the conversation, a person could have a 4th person contacting them. Because everybody in that health district has the same badge, the patients that we serve would easily make the leap that every person knows about the other disparity, right? Think about what happens to you when you go in for your personal visit to your provider. Do you assume that when people come in to talk to you, that they're talking to you and they have debrief with each other? Wouldn't you be very surprised if the nurse practitioner and the physician said something different? So we have to make sure that we reduce duplication of services by taking the opportunity not only to work well with external partners, but to work well internally. All right, reducing costs through joint funding. Now, whenever I say this, I always get people to say, Michelle, are you asking us to break the rules? Or are you telling me that somehow we can take funding designed for another area and do something else with it? The answer to both questions is no. What I'm telling you is you may want to think about cost sharing. So several years ago at the state office, in order to have a program collaboration and service integration conference, TB, HIV, STD, hepatitis, and immunization came together to host the conference to invite everybody at one time. And I even challenged every program to invite their CDC project officers. So when we talk about integration, we usually just talk about one program. If you work in STD, you're going to naturally think to work with HIV. If you work in TB, you're going to naturally think that. Well, now we have new players. Y'all, we're trying to kick off a syringe service program. We need to naturally think about our partnerships, not only in hepatitis, but opioid, and make sure that when we're coming to table with our community groups, that we're not leaving any of those groups behind. Now, I want to talk specifically about sharing data. Data matching is amazing, but we usually do that after the fact. Can you imagine what we would learn if we could share data and find co-infection while people were actually being worked as cases? It's a great opportunity. COVID-19 is providing an opportunity for us to have health conversations in a way that often is a little destigmatizing because everybody wants to talk about it. So some of you may be familiar with, there is a federal initiative to end the HIV epidemic. And just because we won't say ending the HIV epidemic, we have to say EHE. So EHE initiatives are happening in Fulton, DeKalb, Gwinnett, and Cobb counties now. But we also have community advisory groups. We had a meeting, and the first question at the EHE meeting when the pandemic hit was, how does COVID-19 impact those who are living with HIV? How does it impact service providers, and how should we be educating clients? When we move to telehealth models, are there any limitations with technology? Do all of our patients have smartphones or access to the internet? Are we coming up with ideas that are very inclusive? Food for thought. Integration goals. Make it easier for people to access service by a single point entry. I worked in Fulton County for many years, and you need to know, when I first started in public health, I did not have a computer. I had a typewriter. And let me just say, it wasn't even a fancy typewriter. It was old school, where I had to get to the end and then swing it back over. There are some of you who may not know that public health was challenged with resources in that time. You may have thought this was something that just hit. So if you wanted to go to more than one clinic at that time, there was not a systematic, integrated electronic way to get you in all of those clinics. You had to manually register. So if you were in the STD clinic and you need to go to TB, you had to get out when you finished and go to the TB clinic. So most of us have moved past that. I would be surprised if there's any district that has a typewriter in use. If you do, please put it in the chat and we can add you to the prayer list. But many of us are dealing with challenges like not being in the same versions with systems like Mitchell and McCormick. So you may make assumptions about what somebody has access to receive, or you may have a district that is hand counting something that you can pull out because it is a difference in version. So as we think about integration goals, those goals don't stop. We want to continuously move to being the best that we can be. Okay. Increase a staff member's knowledge. If I can go back to when I first started in public health, I would want to increase my knowledge of overall programs. I felt really knowledgeable about the program that I worked in, but it never crossed my mind to make certain referrals, because during an orientation, I didn't understand the bandwidth of services that we had to offer. For many of us now, if someone enters into a women's health space, we naturally not only think about sexual health, but reproductive health. But categorically, we didn't always use the term women's health. And we may have thought about family planning in a way that we thought about reproductive health, but not sexual health. So I want to make sure that we don't miss the opportunity. We talked earlier in the opening session about this new workforce that is coming into public health as it relates to COVID-19. Let's not miss the opportunity to orient to our services. I never forget, I was talking to a colleague who was in a rural part of Georgia, and specifically her background was substance abuse. And many of our agencies received SAMHSA dollars that allowed them to do HIV testing. So when I talked to her about referring her client to the health department, she literally said, "Oh, Michelle, my clients would never go to the health department." And I said, "Why?" And she said, "It's a lot going on. It's a small town. It's very stigmatizing." No, Michelle. And I said, "Okay, where do they go to get their immunization records?" She said, "I would imagine the health department." I said, "Is this person receiving any other services?" She said, "I think they're on WIC." I said, "Where do they go get it?" She said, "I think the health department." Okay, y'all, we have to let people know. If the people in WIC have established a rapport that make clients love them and come back, if you are in acute epi, we need to get the person from WIC to tell us how to do it. Even it might be so much as adding a smile to it. I never forget, I was a part of a focus group, and the community members were supposed to talk about health department experiences. And something that struck me was somebody said, I understand confidentiality. So you may refer to me as an alpha character. You may refer to me as a numeric character, but why not refer to me first as a person? They said, I remember being asked about my sexual behavior and partners without somebody saying good morning to me. That was very powerful. And that came from a focus group. And I remember going back to the office saying, hey, I know it gets pretty hectic. And sometimes we may forget not only to greet each other, but we got to remember to greet our patients. So if I can ask you about your sexual preferences and partners, but I can't say good morning to you, that may create a disconnect. So when it says increasing staff members' knowledge, don't take for granted the level of knowledge that we have increased. Have you ever seen something going on in your health department or your place of work and you go, wow, I didn't know that. And the reason why you didn't know was not because somebody didn't want to share it to you. They didn't recognize that it fell within the scope of your duties. So they just didn't think to share it with you. So once they find out, you're going to be invited to every meeting, sometimes more meetings than you would like to, right? I'm sure that in this particular time, some of us could pass on being added to additional meetings. All right, so if we do this, look what else happens. It increases communication between staff and agencies. It really does. If I use this example, I have had the opportunity to work with Rachel and Amber based on where they work. I am newly acquainted with Jessica, and it has been really nice working with Jessica, and I hope that it has been nice for her as well. And now we will have the opportunity for future collaborations. Think about collaborations that you may be missing out internally just because we haven't had the opportunity to increase communication. And so I realized that for some of us, your partners are in virtual spaces. I like that Rachel pointed out, it would be nice if you all were here on the beach with me, all right? We will be together soon, but while we are not together, how do we increase communication, integration, and collaboration? Because we want to make sure we serve our clients to the best of our ability. Remember Zika? Remember Zika. Remember when we thought, what in the world just happened? Who would have ever put an environmentalist, somebody from maternal and child health, and somebody from STD in the same room at the same time? All right, as the queen of integration, I'm going to tell you, I would have never thought about it. I would have never thought about it. So Zika helped us collaborate more internally. When this hit, Dr. I want to say Frieden was the director of CDC and called for a nationwide conference. And every state and US territory had to meet at CDC. And they said, we need environmentalists, maternal and child health. We need everybody in the room. So I want you to think about it. When we learn things from other areas, let's take the opportunity to keep moving forward. Some of us have been in programs. If you are an environmentalist, then naturally the lead program and your asthma checks have always put you in situations with chronic and maternal and child health. I'm sure collaborating with STD was a first for environmentalists. I'm going to tell you why I know that for a fact. Because we came up with something called a Zika Condom Kit. And you can only come up with a Zika Condom Kit if you have previously been in STD, right? So we got with our environmentalists and say, hey, when you guys go out, it might be a missed opportunity for people not to understand that the possibility of Zika being transmitted sexually does exist. So what we did was put the information together where you gave education around Zika. We put information in there about how to correctly use a condom. And we also put DEET repellent in there, as well as lubricant and a business card. What is interesting, when we were at our nationwide conference and we were all called to CDC, Dr. Frieden said, don't we know how to stop the transmission of sexually transmitted infection? Why are we recreating the wheel? I want you to know these Zika condom kits got so much attention that AmChip even asked about them. Don't be afraid to give up good to go for the great. For the sake of time, I would like to pause in the presentation to see if there are any questions or comments. You can put them in the chat. I think there's a lot of us, so unmuting ourselves may not go well, but let's start with putting them in the chat. Anything hit? Okay, then we'll keep going. I want to share a case study, and we're going to call this young lady Jane. Diagnosed with multiple drug-resistant TB, diagnosed with COVID-19. The folks who were addressing her TB diagnosis were unaware. The number of TB contacts was over 15. Number of secondary cases, over 3. Opportunities for collaboration and integration. Please put it in the chat. One, we want to make sure that we have the opportunity to work with all our colleagues. I like that. STD screening for Jane, absolutely. Great idea. And just because we said it earlier, STD screening also includes what? HIV screening. By age, we want to think about her ability to reproduce. May need to talk to her about her reproductive health as well, right? The folks who were contacts for TB may have also been contacts for COVID-19. I want to shout out Crucial Conversations for a minute. Usually when people are talking to us in public health, they have decided we are subject matter experts, but they don't always shout out our customer service and soft skills. Crucial Conversations is an excellent book, and it talks about how to hold conversations when the stakes are high. I want you to know that we are uniquely gifted at holding conversations when the stakes are high. Just about the information we share with our health, each other, but also immunizations. I like that as an opportunity, as well as HPV screening. But we want to make sure, just like we serve our clients, that we are also aware and sensitive to how we talk to each other. Crucial conversations are very important. It's okay to walk something back, and if you walk something back, it may be appropriate to apologize. It's okay. We have learned a lot about COVID-19, and things changed at the beginning. We've had various opinions, sometimes super passionate about whether you should wear a mask or not, whether you should wear a mask at all. I did a presentation at Emory, and I asked, is a condom a prevention tool or a political statement? They said prevention tool. I said, is a mask a prevention tool or political statement? Quite a few people said political statement. Make it safe. You can think about critical questions. Always you want to maintain respect. Move to action. I like talking about unbossy bosses, just because people use the term boss to sometimes mean bossy. Unbossy Boss is a great book. It talks about how to engage your employees, how to tell and not yell. I'm an avid reader, and I think about reading things that will help me not only be a better person in terms of community outreach and engagement, but also a better partner internally at the health departments, and also a better partner working with health districts and academic institutions as well. Employment engagement keeps people involved and engaged. Many of us stay in public health for a very long time, and we like it so much that when we retire, we come back as consultants. So I have always thought, public health, y'all got me. I don't care if this bob is completely silver. I want to be doing something towards helping people. I'm leaving my contact information up. I realize in this setting, it may not be always the best way to engage. I hope that if I've said anything of interest, you would like to reach out. I also hope that there is an opportunity for future collaborations between the health departments, the community, and our academic partners. I am very interested in being hands-on. So the invitation to work with you is not about you being in Metro. We're at the state office. That means we're responsible for the state of Georgia. I would like to shout out the Waycross districts who met me in Statesboro at Georgia Southern University to test people for HIV and also for us to tell them conversations about COVID. Have car will travel. Shout out to Cobb for taking my interns out for National HIV Testing Day. If you need help and assistance, I would like to know how I can make that happen for you. So I want to end by saying, dear team, you're all amazing. Keep up the great work, and thank you for allowing me to join you from the virtual sandy beaches of 2 Peachtree. Thank you so much.
Thank you so much, Michelle. On behalf of the GPHA Epi section, we couldn't have picked and had a better speaker for our session, and we greatly appreciate all of the knowledge that you have shared with all of us. I think we have about 4 minutes maybe left. If anybody has any questions and you'd like to kind of put any of those in the chat, I'm sure Michelle would be happy to answer any of them. I just see lots of great presentation, Michelle, and thank you to you from all of the attendees. So no questions yet.
I know we have a lot of new grads that have joined us, like you talked about, Michelle, this brand new workforce. Do you have any pearls of wisdom for them on how to kind of navigate these waters in a career? A lot of them are starting out as, our temporary COVID workforce. And what are some ideas you might give them to kind of get their foot in the door in state or local public health?
I think that's a great question. I do a lot of coaching and mentoring, and I am still tremendously blessed to be coached and mentored by a lot of great people. So one thing that I say to people who are entering any workforce, but potentially ours, get a mentor. And one thing I say to them is everybody needs somebody that will root and cheer you on. Things sound very differently when you are thinking about public health as it relates to your jurisdiction. And sometimes the problems that people have with public health in a particular district is not a district problem as much as a global public health issue. So the one thing that I think we need to recognize is people are drawn to this work because of their dedication and their heart for service. This is not how many of us presume we're going to get rich. I want to be in public health because I want a fancy car. I don't think any of us signed up for that. So I think as managers, one thing also that we could do is be patient and recognize that dedication and passion to the workforce. For the managers receiving this great bunch of energetic people, let's not be afraid to get new ideas. And I think that if we also share some of the things that we are a little nervous about, I share that I'm a very old school person. And so sometimes I could be intimidated by technology. And so when I say, hey, is there a better way or a faster way to do this? They usually push me to the side and do something that takes an hour for me in 20 minutes. And then so that mutual respect is laid for ideas. And I say, you know what, let me tell you something about public health that maybe you didn't get a chance to see. So I think that we have to recognize many of them are coming in with MPHs, and that's not something that we've always had the opportunity to experience. And so we have to figure out how to not only embrace that new skill set, but utilize it and welcome into the place. Because it could be a little bit intimidating to work with a bunch of subject matter experts. Some of us have written books and articles, and you're coming in and you don't know how to find your voice. So I share little nuggets of wisdom. You want to sit at a table, bring a chair. That's one way to get at a table.
Definitely. Thank you so, so much. We've got some amazing new people on our team, so we want to keep them. Thank you.
All right, it looks like we're just out of time. So thank you all so much for attending our Epi section meeting and presentation today, and hope you enjoy the rest of the meeting and conference. Thank you so much, everyone.
Thank you. I'm going to see if I can catch a wave.